Advances in technology have significantly improved joint replacement surgery. One example is robotic-assisted knee joint replacement. There are many different robotic systems on the market. The system that I prefer, and I believe to be better than the others, is MAKO from Stryker. I've been using the MAKO system since 2005 when it was initially introduced for partial knee replacement. The system is now available for total knee as well as total hip. The MAKO robotic system allows surgeons to plan and perform the procedure with a high level of precision, accuracy, and reproducibility. Prior to the surgery, a CT scan is performed of the joint, which is loaded into the robotic software. Within the software, the joint model can be manipulated to generate the ideal surgical plan for the implants. This plan is then modified during the surgery to factor in soft tissue features that are highly variable from person to person. This is called soft tissue balancing and is a critical part of the procedure and necessary in order to achieve an optimal result. During the procedure, the robotic system guides the cutting device in such a way that it will remove bone in a highly precise fashion and following the surgeon's plan. The cutting device also will not deviate beyond the plan, thereby protecting soft tissues. In addition, since the system can see the anatomy without a full exposure, the procedure can be done in a less invasive fashion. Once the resection is complete, trial implants are placed by the surgeon and the joint is then moved through the range of motion. It is at this time the balancing is checked using the MAKO system. The goal is to have symmetric 0.5 to 1 millimeter gaps throughout the joint. What this allows for is mobility, but without instability. If the gap measurements are not adequate, this could lead to a loss of motion during recovery. If the gap measurements are too large, this will lead to instability during recovery. Neither is ideal. The goal is to achieve proper balancing so that the recovery will not be negatively affected by inadequate or overly generous gaps. The procedure often takes 1 hour for implant placement, and discharge from the facility is often the same day. The overall goal using robotics for knee replacement is to provide better patient experiences with better function, reduced post-operative pain, and to help patients return to normal activities as quickly as possible. At iOrtho, robotic-assisted knee surgery is one of the many tools we use to deliver advanced orthopedic care.